It's time for Truth or Fake. Vedika Bahl joins us over by the big board. Vedika, good evening to you. Donald Trump yesterday suggesting a connection between autism and the widely used painkiller paracetamol. This in spite of decades of medical research that says that the drug is safe. Tell us more.
That's right, Mark. Donald Trump said that doctors in the US will soon be advised not to prescribe the painkiller paracetamol to pregnant women because he says that the use of it in pregnancy is actually linked to an increase in autism. But he didn't really provide much scientific evidence to back up these claims. Now, paracetamol, also known as acetaminophen, or also known under the US brand name Tylenol, it has long been considered the safest over-the-counter option for pregnant people if they're experiencing pain or experiencing fever, but Trump urged those who are pregnant not to take it, or he told them to limit it if they couldn't, in his words, tough it out. Let's take a listen now to an extract of his speech yesterday.
Effective immediately, the FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism.
So there you have it, a little extract of what Donald Trump said yesterday. But as I said, this claim is not supported or backed by science. And in fact, the American College of Obstetricians and Gynecologists were also quick to reply to Trump, saying that this suggestion that he's making with the link to autism is not only highly concerning, but also irresponsible when you consider the harmful and confusing message it gives to pregnant patients that are relying on this painkiller just to get through it, Mark.
Acetaminophen. Paracetamol. Vedika, what does science actually say? Tell us about that.
Well, there have been several studies into acetaminophen use in pregnancy and autism. Experts say that the science and the connection between them isn't really settled, and the autism, it just can't be connected to one single cause. It is very much a complex mix of genetic factors, environmental factors, and so all the studies, there have been several of them, they haven't really proved a causal relationship, and we have to remember here that correlation does not mean cause. But the biggest study from 2024, it investigated nearly 2.5 million children in Sweden, and in fact it disproved that acetaminophen use during pregnancy, it didn't associate it with children's risk of autism. Now, during his speech, Trump also repeated many unsubstantiated claims about specific communities that he says don't have autism. Here's one. He said Cuba doesn't have the money for Tylenol and they have virtually no autism. This is a sweeping statement, to say the least. There was a 2017 paper that looked at Latin American and Caribbean medicine, and it found that one in 2,500 Cuban children was diagnosed with autism. But this study also said that that number was likely an undercount due to what it called flawed surveillance methods. Now, there was also just limited research on this topic in terms of autism in Cuba. So it really is unclear here what Donald Trump was basing that statement on. Now, he made a similar, rather large sweeping statement about the Amish community in the US, saying that they have virtually no autism due to no vaccines and no pills. Again, there is very relatively few studies on the Amish community. They are very well known to live in isolated and remote communities. They famously reject modern pharmaceuticals often. There is one paper from 2010 that identified autism in 1 out of 271 Amish children, and that's out of nearly 1,900 children tested. But this study also found that the role of caregivers and the norms and customs and the role of caregivers also might have something to do with it. So overall, the science is just simply too limited for Donald Trump to be making sweeping statements like this overall, Mark.
And on such an issue, it's incredibly emotive for all expectant mums, families across the world when you hear someone who is the President of the United States making such a remark. It is incredibly emotive, isn't it? You mentioned vaccines there. Another thing Trump linked to autism, again, without any real scientific evidence.
Yes, that is correct. He was joined at the podium, though, but with his Health Secretary, Robert F. Kennedy Jr., a man who was famously a vaccine skeptic and also someone who has well-documentedly spread misinformation about vaccines for decades now. And it was this vaccine section that I think was the most alarming unsubstantiated claims. Donald Trump said that fragile babies were being pumped full of vaccine liquid like horses. He said that combination vaccines were harmful. He said that the MMR vaccine in particular should be a single dose. And the WHO, the World Health Organization, has slammed this statement. They were very quick to dispute Trump's claims, saying that the science was there to completely disprove him. This is a statement from the spokesperson who said that we know that vaccines don't cause autism. They save countless lives. So this is something that science has proven, and these things should not really be questioned. So Donald Trump has been fact-checked by many different scientists and people here. But overall, what I want to say is that whilst Trump is claiming that autism is on the rise, we also need to take into account one last thing, and that is that the tolerance, the attitude, the diagnostics for autism have all changed massively over the last few decades, and we're also testing more people now. So I think that also needs to be mixed into the equation. But either way, Mark, the conclusion is here that Donald Trump yesterday in his statement about acetaminophen, about vaccines, there's a lot of statements with little scientific backing that he's making.
Indeed, but we do know that Trump will continue to make those statements regardless of their spurious nature or lack of any kind of foundation. Vedika, thank you very much indeed for Truth or Fake.